Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Welcome to our podcast series, Living with Lyme Disease, Diagnosis, Treatment, and Healing. In this first episode, we're going to really dive into the complexities of diagnosing Lyme disease, which we know is a condition that often presents with some really diverse and ambiguous symptoms. And then in episode 2, we're really going to focus more on the treatment options and some strategies for supporting patients who are living with Lyme disease. Now, joining me for this discussion is Cheryl Kuzo. She is a dual board certified adult and family nurse practitioner. She specializes in Lyme disease and co-infections, but also, Cheryl, you have your own story with Lyme disease.
I do. Thank you so much for having me on, Candace. It's awesome to be here and speaking to this audience in particular. And my story started like everyone else's, pretty much. I was working within the allopathic healthcare system. So I worked as a nurse and as an RN in a variety of different roles. And I even had a stint in pharmaceutical research as well as critical care and education. And yeah, so I've been like all across the spectrum. And after becoming a nurse practitioner, I spent most of my career in the acute and the subacute settings, but never ever did I expect that I was going to ever become a patient and that I would be a consumer of this healthcare system that I worked in for years. And not only that, but one who would end up falling through the cracks of the system. So in 2014, I was hiking in Vermont and I had an insect bite on my back. So I didn't have an adherent tick. I just had a bite, little bit of skin missing. Didn't really think anything of it. 2 weeks later, I was acutely ill. I actually had flu-like symptoms. So I thought I had the flu. And 4 days later, I was in the emergency room getting admitted for a 7-day hospitalization, which is a long time. Like, you have to be pretty sick to be in the hospital for 7 days. And
yes, especially a nurse.
Yes, absolutely. And I had symptoms that were affecting nearly every organ system in my body. And despite the obvious tick bite, or insect bite, I should say, the possibility of tick-borne infection was actually dismissed because I was told that my tests, which was the standardized CDC panel, had come back negative. So they began treating my symptoms, but the cause remained a mystery. I was actually discharged with no diagnosis other than that I probably had an autoimmune disease, and said, you're probably going to be debilitated in 10 years to some level. So I inherently felt like there was something else going on. I was still curious about this bite on my back. And I went from provider to provider. I didn't get any clear answers. And despite having medical insurance, I actually spent $10,000 that year alone out of pocket trying to figure out what was wrong. I was just given medications to mask symptoms. Yeah. And nobody had answers. Nobody had answers. And I felt a bit medically gaslighted by certain clinicians as well, who absolutely told me with certainty I did not have Lyme disease. So I felt like also my physical illness was also compounded by a lot of emotional and mental exhaustion by dealing with that, and also dealing with, I had a lot of personal grief and loss that happened at the same time. So I was completely depleted. But by my gut instinct, I ended up seeking out the care of a nationally respected naturopathic provider who was literally like practiced practically in my backyard. And he eventually became my mentor. His name was Dr. Jim Senseneg. He passed away in 2019, but he was the one that through specialized lab testing diagnosed me with Lyme disease and co-infections. And with this also, I had an active reactivation of the Epstein-Barr virus, having had mono as a kid. So this was really the turning point for me. And I went down the rabbit hole of embedding myself in research on functional medicine and natural holistic remedies, everything I could possibly get my hands on, because I wanted to do everything possible to heal. And I was actually very fascinated by the whole journey, because this was new for me as a patient. I was used to being the provider. So through that process, I was able to give my body what I needed foundationally to be able to have my therapy start to work. I actually healed without taking a single drug. So everything was natural remedies.
That's amazing.
Yeah, and quite uncommon, but it does happen, and we can do it. So it was a very long, non-linear journey. I had some relapses along the way. I learned how to deal with the stress as well that was making things worse. So a few years later, I felt like I was in even better physical shape than I was before I had Lyme. And I celebrated this by hiking to the summit of Mount Kilimanjaro. So over 19,000 feet.
Oh, wow.
Yeah. It was a really symbolic climb, because it wasn't really just about the physical strength I had regained. It was really about the whole journey that I had, slow, intentional, but incredibly moving journey that propelled me to my next chapter. So,
and you're really describing those intricacies of Lyme disease and how you get that diagnosis. And so I'm really grateful that you're here to share your story and to also share from that provider perspective to really help other providers navigate those challenges that you went through, really to improve their own patient outcomes.
Yeah. Yep.
And what I didn't realize as I was preparing for this series with you is that Lyme disease is not actually just a U.S. problem. I really thought it was just more of a U.S. problem with ticks, but it's actually reported in all 50 states and also more than 65 countries worldwide, including Canada, parts of Europe, Asia, and Africa. So Lyme disease in itself is very far-reaching.
It is. Yeah. There's millions of people worldwide that are suffering with it. And you're correct. I actually looked up recent statistics preparing for today, and the most recent are more than 80 countries. And it is in all 50 states. So, of course, we have areas that are more, more endemic than others, like the Northeast where I live, but it is in all 50 states.
So can you start with walking us through what is Lyme disease and the primary causes and vectors? Because, we know a tick-borne illness, but are there other vectors besides ticks?
Yes. So let me just start by explaining what Lyme disease is. So Lyme disease, for those who don't know, is an infection that is caused by a spirochete bacterium, so a corkscrew-shaped bacterium, which is known as Borrelia burgdorferi. So it's generally transmitted through the bite of an infected tick, most commonly what we call the deer tick or the black-legged tick. And just to give a little historical context, so in the 1970s, there was this cluster of people in the area of Lyme, Connecticut, which is actually not far from where I live at all, who presented with symptoms very similar to juvenile rheumatoid arthritis. There were a lot of children that were also involved with this symptomatology. And so studies were being done to try to figure out what was going on. And a few years later, an entomologist by the name of Willy Burgdorfer discovered the bacterium as being the cause of these symptoms. So it was subsequently named after him. So Borrelia burgdorferi. And it is most common in the northeastern, north central, mid-Atlantic, and Pacific coast states. But like we said, it's been found in all 50 states. And ticks go through life stages.
Right.
And all life stages of ticks can transmit Lyme, but the little nymphs, which are like the size of a sesame seed, are the most likely culprits. So
Oh my goodness.
a lot of people don't know that they even had a bite. And so when a tick bites, their saliva contains an anesthetic. So oftentimes the bites are painless. So you don't know they're there, and it's teeny tiny. The longer it's attached, the higher the transmission risk. So it's a really tough disease. And so to your question, there is some evidence that suggests the presence of Lyme in other insects, mosquitoes and spiders. I think I may have had a spider bite by the way that my bite presented. It was a very strange looking thing. But I can't be sure, and I never will know. But there is some evidence to suggest it is in other insects. And there's also evidence to suggest that there's congenital transmission from mother to child. So if the mother contracts Lyme in pregnancy, she could potentially pass it on to her child.
Right.
There are some rare reports of possibly placental issues, miscarriage, stillbirth related to that as well. And lastly, there is some research ongoing about a potential sexual contact, so person-to-person transmission via sexual contact as well.
Now, what are the common early symptoms that you see for Lyme disease, and how do those symptoms progress if they're left untreated? And I know you have your own nonlinear story of how your symptoms progress, but also, what is that typical?
So my story is an individual story of, in a way, though, it does happen very typically to people that they're fine and then they're not fine and suddenly they're very sick. But then there are some people that it's more insidious. There are stages of Lyme. So I always say to people, Lyme shows up differently in every body. It is known as the great imitator, and that means that it can mimic other disease processes like multiple sclerosis, RA, ALS, mood disorders. So it does not follow a linear path for most people, but there is a 3-stage progression that happens. And stage 1 is early localized Lyme. So this is like the first 30 days after a tick bite, where the bacteria is multiplying near the bite site. And this is when people typically will present with flu-like symptoms, like I did. Maybe not so acutely ill, but will oftentimes have, usually fatigue is one of the number one symptoms, and fever, chills, headache, muscle joint pain, swollen lymph nodes. This is also where you might or might not see the classic bullseye rash, which is the erythema migrans rash. So actually less than 50% of patients get this rash. So we can't count on the fact that somebody will or will not have a rash. And it doesn't always actually appear as that bullseye or target looking rash. My rash, actually, you could almost not even tell there was anything there. But I have a picture of it, and you can kind of see in the picture this hue. But it was very elusive. And also, the rash does not have to occur at the site of the bite either to make it that much more complicated. So, yeah. So if you could catch it in stage 1, it is a little bit easier to treat, but it's oftentimes not caught early enough. And we'll eventually talk about that. But stage 2 is early disseminated Lyme. And this is weeks to months after infection. And so the bacteria is now spread through the body. it forms a protective biofilm around itself, which makes it that much more difficult to penetrate and kill off the bacteria. So symptoms start to get much more complex. You'll see sometimes people present with Bell's palsy. They'll start having severe migraines and neck stiffness, almost like meningitis type of symptoms, shooting nerve pain and numbness. I had the worst nerve pain down my arms and legs that I actually couldn't walk. By the time I got to the ER, I couldn't even walk.
Yeah.
Patients will have migratory joint pain. You could have eye issues like uveitis or like spatial visual processing issues. Cardiac symptoms are actually very common. Lyme carditis is common, and a lot of patients will get POTS, what's called postural orthostatic tachycardia syndrome. So it's a dysautonomic issue, and also sometimes patients will develop a mast cell activation syndrome, or MCAS. So there's all these disease processes.
Well, that makes me want to ask you, so if somebody comes to you with symptoms of POTS, should you then maybe just go ahead and test for Lyme disease just to make sure that it's not?
Yes. So I do a really, really comprehensive intake. And so oftentimes if somebody presented with POTS, I could kind of put some puzzle pieces together with other things that will make me suspicious of Lyme. And, I'm also asking questions about exposures and things like that. But I would more often than not test if somebody comes in with a symptom like that. And like I said, they usually have other things going on as well. But the testing is that's a very complicated thing to deal with as well, because it's not always accurate. So I did want to mention too that
when you don't, go ahead.
Sorry, I did want to mention just before I keep going down the rabbit hole, is that we're talking about Borrelia, Lyme Borrelia, but I just want the audience to also know that there are co-infections that happen, that other pathogens can exist and can be transmitted within a tick bite. And so ticks carry a bunch of other pathogens that can make the symptoms much more severe, and actually the treatment's more complicated. So most chronic Lyme patients have at least one co-infection. They say that over 30% report 2 or more. I think it's way over 30%. I had a co-infection of mycoplasma. And just so the audience is aware, that the most common ones that we see are Babesia, which is actually a parasite, Babesia, Bartonella, Ehrlichia, Anaplasma, Rickettsia, which is known as Rocky Mountain spotted fever, Mycoplasma, which is an atypical bacteria, and then there's tick-borne relapsing fever, which seems to be more and more common. That's actually a relative. It's in the Borrelia species, but it's a relative to the Lyme Borrelia. And then there's also tick-borne viruses as well. So these things will all complicate everything else that we're talking about, can become much more complex to diagnose and treat. And then there's stage 3.
Yes. So how do you differentiate? How do you differentiate what you're looking at?
Yeah, it's hard. And so not everybody goes through all 3 stages too, and some just go right into late stage Lyme, which is stage 3. So it's tricky. There's no single standardized diagnostic criteria or treatment protocol. And so sometimes it becomes a diagnosis of exclusion. If you test somebody and you get a negative symptom, it can also really just be based on clinical picture, especially with no rash or no known tick bite. So clinicians need to become really astute investigators, and there's some red flags that would alert me that if somebody has suddenly, developed this intense fatigue, they have migratory joint pain, and a big one is actually cyclical symptoms. So patients that will say every 3 or 4 weeks, things get worse for me. And actually, a lot of them will tell you that they feel worse around the phase of the full moon. So this is very common. I hear this all the time where they say, when there's a full moon, I feel like garbage, and then things seem to get better. So just being aware of those cyclical symptoms. Also with women, they can be cyclical around their menstrual cycle. So asking also about not just have you had a tick bite, but have you had any insect bite? Environmental exposures also. So mold is a common cofactor for Lyme as well. So those are things you also want to address. And then travel history. Also want to ask them if they've been out of the country. I actually, when I was diagnosed, or when I got sick, about a month and a half, I think, before that, I traveled to Iceland. So they were asking me all kinds of questions like, were you like hiking through caves, and did you, eat unpasteurized cheese and all these things? So which I had done none of. So yeah. So it's really, the clinician needs to remember that testing is not the be all end all of excluding Lyme as a diagnosis.
So what I hear you saying is that most of the diagnostic testing for Lyme disease is not that reliable.
It is not. So the standard test is
what do you do?
Yeah, what do you do? So I will tell you what the CDC standardized testing tells you to do. The CDC standardized test says to measure the IgM antibodies, so that would tell us if there was a recent infection, and the IgG antibodies to see if that would tell us if there was a later or persisting infection, to see if these come up positive. So it's a 2-tier testing. The first tier is a screening. It's the ELISA screening. If the ELISA is positive or equivocal, then the lab usually automatically does the Western blot, but it won't run it if the ELISA test is negative. And then the Western blot detects antibodies to multiple Borrelia proteins. So for the CDC to say that a test is a positive result, you either have to have 2 out of 3 positive IgM bands, or 5 out of 10, at least 5 out of 10, positive IgG bands. And there are certain bands that are more specific to Lyme. The limitation of this, though, is that the ELISA test, which is the screening, is false negative at least 50% of the time. So the CDC criteria is missing at least 50% of actual cases. I had a positive ELISA, and on the Western blot, I had only 2 positive bands and of IgG bands. So they said my test was negative. Now, as a clinician, with somebody who was that sick, knowing now what I know, because I didn't know it then, I absolutely would have treated this person. So, and so there's actually some states that require the labs to disclose on the lab report that a negative test does not necessarily mean that there's a lack of infection. So, providers they're understanding this, and there are specialty labs. There's quite a few specialty lab tests that you can send out. IGeneX is a very well-known one. Vibrant Wellness and MDL are they're probably the 3 most well-known. So they have a broader coverage of the strains, and they include more bands than the CDC criteria does. So, but it's costly. It's not always covered by insurance. So there's barriers to access there. But the clinical diagnosis is key. You cannot just go by the labs alone.
Does the timing of the test impact the accuracy of the test?
It does. And so that's where we run into a lot of false negatives, because if it's too early and you haven't mounted the antibodies, the test's going to be negative. And also, some patients, they don't present so acutely ill that they're not really sure what's going on, and then they wait to be tested. So it's a really narrow window of opportunity to get a negative test. And, those tests, the CDC test was really meant just for surveillance purposes. It wasn't really meant to be this diagnostic tool that we were going to base everything off of. So, again, that's where we can't really rely on the tests. We really need to look at the whole clinical picture.
Even as a surveillance tool, it's still missing 50% of those that they would need to know had Lyme disease.
Yeah.
So they're not really surveying well.
No, they are not. And it's a 50-year-old test. I mean, it's just crazy.
And that makes me wonder, how do you, in the beginning, when you start seeing somebody, how do you differentiate Lyme disease from any of the other conditions that might have similar symptoms?
So it's really building that clinical suspicion and considering the regional risks of infection. And again, listening to the patient and their lived experience. You really want to get a whole timeline of what's been happening. When did it start? What were the first symptoms? How did it progress? Is it cyclical? What other are there environmental factors involved? And then, of course, also considering co-infections add in a whole nother level. If I feel that I need to test, I will sometimes use the CDC version of the test because most of the time their insurance will cover it. I've actually not had a patient that it didn't. And if it came up positive with any positive bands, and they're presenting clinically like somebody who has Lyme, they should be receiving some sort of treatment. So sometimes that is a good starting point because you might get the IgG positive bands. If I get a negative test, we could consider doing one of the more specialized tests. Or is there something else going on and that we need to investigate? So it oftentimes does become a diagnosis of exclusion for a lot of people, unfortunately. But that by then now you're talking stage 3, late disseminated Lyme. And now things tend to be much more difficult to treat.
Right. You're checking a box of ruling, what can I cross off of my list that leaves me with Lyme disease, which some of the things you've mentioned, I identify as challenges for healthcare professionals. Like, we don't have a reliable diagnostic tool. Lyme disease mimics so many other diseases that we have and syndromes that we have out there. Plus, you have comorbidity infections. So besides those, what other challenges do you have as a provider trying to diagnose Lyme disease, and how do you overcome those? Are there others?
I would say the lack of consistent guidelines around diagnosis and treatment make things difficult, especially when you have to liaise with other healthcare practitioners that maybe aren't quite so open to thinking out of the box. So that can make things a bit difficult. So you do want to get your network of people that are going to be a little more open-minded about talking about something that's not showing up on a test as positive. There's a stigma around the term chronic Lyme because the CDC actually doesn't recognize Lyme as a chronic infection. And I went to a Lyme specialist that was actually working in the same network that I was working in at the time. And he said to me, "You do not have Lyme disease. There is no such thing as chronic Lyme. You have something else going on." So you need to find your people and stick with them. Yeah. Yeah. And the CDC will now say that people have like a post-treatment Lyme syndrome, that it's, just like not a chronic infection. It's a result of like damaged tissues and things like that, but that it's not a chronic infection per se. So at least we're moving in a little bit of a better direction, but there is a lot of challenges as a healthcare provider with Lyme, for sure.
Would you say that Lyme disease in general has a stigma attached to it, and what that stigma might be?
For patients, I think the diagnosis of Lyme has a stigma when it can't be proven on a piece of paper. Because patients have a hard time making people understand that they are actually sick. And so what they encounter a lot of times is, well, you look fine. And if you have Lyme disease, why don't you just take an antibiotic and be done with it? I could not tell you how many times somebody said that to me when I said, well, it turns out I have Lyme disease. And they're like, but yeah, but you look okay. So can't you just take an antibiotic? So there is a stigma, I think, attached to it. And it's hard because they're spending a lot of money. So they're financially burdened by their disease. They may be not able to work. I had to take 3 months off from my job when I was sick, and I was getting urged to come back and work. And I actually wasn't even cleared to go back by any physician. So there is a stigma for sure. You look okay, but you don't feel okay.
That invisible illness.
Yep.
Yes. All right. As we close out this first episode, I know I do now, and I hope, our listeners do as well, but have just a better understanding of the complexities that's involved in diagnosing Lyme disease and just Lyme disease in general, and that accurate diagnosis is crucial for effective treatment and patient care, and really working to rule out anything else that it could be so that they could get the appropriate care. So I hope you will stay tuned for our next episode, where Cheryl will be back to explore treatment options and strategies for supporting patients on this healing journey with Lyme.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.